Yes, somebody just asked a question. Is this meeting being recorded? These meetings are recorded, and we put them on a webinar series for our YouTube channel, and so that people can go back and listen to them later. So that question just pop up. Okay, well, welcome everybody. Thanks again for being here. My name is David Sturz, partner with Cooperative Strategies with Mary Filardo from the National Council on School Facilities. We've been co-facilitating this conversation for this, I think, our 8th week now, and looking at different topics related around school reopening in the fall, and listening and trying to come up with some guidance that can be uniformly applied and uniformly considered across the states, given all of the plethora of documents and guidance coming out right now. And just really importantly, to have a continued forum for conversation to wrestle with some of these things together. So today, what we're going to do is we're going to just do quick updates on federal funding and the HEROES Act and the GAO report that was just listed today at noon Eastern, and then take a good amount of our discussion time to talk with folks who are on the National Academy of Sciences, Engineering, and Medicine committee, who are going to be working on some guidance for school districts, and give you all a chance to interact with them and to ask some questions. So before we get into that, just some ground settings that we do at the beginning of each of these webinars. What are we here to do? We're here to share some updates regarding federal funding. We're here to create and share some tools. We're here to develop some guidance that can help in different areas of school operations coming to the fall. Today, we are going to do a quick review of federal policy in school facilities. We are going to spend most of our time, as mentioned, introducing the National Academy of Sciences, Engineering, Medicine K-12 School Reopening Commission, describing a little bit about their short letter report that they're going to be working on. We have two of the committee members here, Kathleen Moore and Jeff Vincent, who will be taking questions, and we'll go through the current set of 7 questions that are going to be focuses there, and just have an opportunity to interact with them. And these chat notes, we're going to ask you to put questions in chat so that can be a record for those who are working on the report as they get into it in the coming weeks. Okay. Mary, anything else before we get into it?
Nope. Sounds good.
Okay. All right, let's do it. So again, summary of our working assumptions, something we do every time. We know, we need to be safe, and students and staff. We know that there's no vaccine probable especially in the fall. And so we have to reduce that through social distancing, hygiene, knowing that these strategies are going to change. So we need to be flexible and come up with multiple strategies and triggers to employ them. That schools and buses are not organized or funded to do those social distancing work. So we have to be creative, and then we also have to ask for the funds needed, because what's being asked of public education is enormous, and we are not starting from a level playing field, and that's something the GAO report has highlighted, which we're going to do a quick summary on today. And lastly, parents can't be fully productive without school districts providing schooling, and that is a symbiotic relationship. Schools don't thrive without local economies thriving, and vice versa. So we are in a conundrum, of course. Okay, so in the last couple of weeks, we talked about engagement, and there's been some exciting work that school districts are doing, and many of you shared it. We had really robust chat. You did not see the chat notes from last week. There's a lot of great links and resources that you all put in there, so please take a moment to read back through those and follow all the good links that you were sharing with each other. And if you didn't get that, reach out to Mary and I, we can send it. One of the themes, sort of the loop that we're looking at, directions here for engaging your community, really is be informed as you can, because this information, like the GAO report, changes daily and there's so much to digest. Just carving out time to read and be informed as you can, and talk to your peers in forums like this. Be curious. Know that answers that we've had are not all the answers we will have. And for example, schools in Europe are opening right now. Let's be curious. Keep our ears to the ground. What's happening there? Be open to different strategies. Be open to different feedback from your community. Be responsive to that, really responsive, even if we don't know all the answers. Assess how are we doing and just keep that loop going. So one of the things we offered is that we have a survey if you'd like us to help create and analyze the survey for you. If you don't have the bandwidth to do that, we'll get it done. So you can reach out to us if you'd like us to work with you on creating something and analyzing for you, just to get the ball rolling if it's not already in your communities. Okay. Quick updates. Okay, so the HEROES Act passed the House and it was sent to the Senate, where it was read this week. And under consideration, that includes $58 billion for K-12 education. Now, one of the things that we've done is, as we've been working through our work in this series together, we currently estimate a little bit north of $400 a student in expenses without technology, which across the country we're looking at about $20 billion. If you include technology needs on top of that, that could potentially double that amount. It's not going to be uniform for every school district, of course, but you're looking at somewhere then between $400 and $800 a student, depending on your technology assumptions, which all in would leave, of that $58 billion, only 18 left for state and local revenue loss. And what that quick math really leads to, again, is that there's not enough in there, because we are not starting from a hole. We have many gaps to plug already in terms of HVAC needs, which the GAO report highlights, technology, and so forth. So there is a petition, buildusschools.org, for the BASIC Coalition. And if you haven't already signed on to that and lent your voice towards pushing for school facilities and infrastructure package, please consider doing so. And also, as we continue this conversation, there may be other opportunities to raise our voices about the needs for investment in schools and infrastructure nationwide.
So David, why don't you go ahead and mute folks? There's some folks that haven't muted. David?
Working on it.
Okay. All right. Also, folks can mute themselves as well.
Okay.
Okay.
Mary, this is you.
Okay. So just today at noon, the embargo was lifted on a GAO report that in the FY20, I think, budget, maybe FY19 budget, was put in essentially what would have been the Budget Support Act. Senator Reid, I think Murkowski might have been a part of it as well, requested information on the condition of our school facilities. Kind of thinking back to the 1995 report. So this is quite different than that, but there's still, quite a bit in here that I think I would encourage folks to look at and see how it resonates with your own states and communities. That has probably one of the worst titles on the planet. The title of the report is School Districts Frequently Identified Multiple Building Systems Needing Updates or Replacement. Now that is a winner of a title. But it is what was true, and that they estimated, 36,000 of roughly, it wouldn't be actually of school buildings, it's of schools. So because there's a whole lot more buildings than that. But in terms of the unit of analysis here was the schools, the districts were reporting how many schools had at least half of their schools that needed each HVAC systems upgraded or replaced. That's a lot of schools. And when we did a kind of a quick back of the envelope on if you were going to do, kind of major repairs at about $2.40 a square foot, or if you were going to do replacements at closer to $10 a square foot so then we're looking at anywhere from $9 billion to $25 billion just for, you can see on this next slide, just for the heating, ventilation, and air conditioning systems. So these are major cost centers for, capital projects. but what you can see, what these percents, again, this is sort of this awkward kind of report speak. So this is the percentage of school districts. So right here, they're counting school districts, the percentage of school districts, where half of the schools in that school district need updates or replacements of key systems. So, for example, I was looking, also at plumbing. If we're talking about touchless fixtures, it's one thing to put a new fixture on plumbing that's relatively new. It's another thing to put it on, black iron or lead system. It's very, very different. So while the situation, again, where we're looking at 25% of school districts with at least half of their schools needing major updates or replacement of their plumbing system, what we can see is we've got some really difficult environments within which to meet higher health and hygiene standards within the schools. So go ahead, David, next slide. So one kind of back to our sort of core issues around guidance. One of the things that I'm sure everyone is noticing is there is now a flurry of information and guidance and committees and, nonprofit groups, associations, states that are starting to provide guidance. So one of the things that we're doing at the National Council, working with folks at UC Berkeley at the Center for Cities and Schools, is we have all of the links to the guidance is on the National Council website. So it's all in one place. You can see all of the states. But we're also going in now and state by state trying to do a short summary, and that should be up probably in about, the summaries will be up in a week. The links are already there. But for example, Colorado had an interesting approach where they had what's required, what's guidance, what's consideration, a way for districts to understand kind of the varied levels of requirements in the state for what they need to do around reopening and operating. But there's all kinds of, really good work that's been done in a whole variety of states, and we're trying to capture that because in what we're doing, we want to make sure that first and foremost, we understand what's there. So you can find state guidance resources at the state links on the National Council's website. Go ahead to the next one. On the federal, yeah. So the other thing is that, I wonder what happened to the federal guidance. But anyway, we also have a page on federal guidance where you can track what's happening with CDC and EPA and other things. But but what we want to spend most of today doing is making sure that we have out there for this new committee of the National Academies of Science, Engineering, and Medicine, really specific questions that districts and states feel that they need better guidance on. And with us today are Jeff Vincent and Kathleen Moore, who are on the committee. I don't know if there's any other committee member. If there is, raise your hand and we'll unmute you. But we're really fortunate to have Jeff and Kathleen on this committee because of their deep knowledge and understanding of schools and school infrastructure. So this is Kathleen Moore and Jeff Vincent, but David, when you go back to the, Jeff, why don't you go ahead and start, but then go back to the slide before the intro slide. I think it'll help Jeff as he introduced the committee. Go ahead, back one.
Okay.
Back. Yeah, just go back one. And then, yeah, because this is from their website. So Jeff and Kathleen, do you want to go ahead and introduce the committee
Yeah, I can do that. Hi, Mary, and everyone. This is Jeff Vincent at UC Berkeley. As many of you know, we've been a close partner at the Center for Cities and Schools here at Berkeley with the National Council on School Facilities and state departments of education and others and local districts particularly on school facility issues over the years. And so, we've been fortunately invited to participate in this National Academies of Sciences, Engineering, and Medicine as they are putting together a very rapid consensus study on guidance on whether and how to open safely or physically open safely in a pre-vaccine COVID era. And I think that this is coming in the context of so much guidance, quote unquote, coming out, but very little understanding of the relationship between different interventions and the way in which they promote or discourage the spread of the virus. And so the focus of this report is on health safety issues for reopening. There's a set of questions. So Mary, maybe you can coach me here in terms of how detailed you want to go on this. I can, Kathleen can kind of, I guess, jump in and introduce herself as well. But
yes,
I think,
Jeff,
go ahead.
What I think will be helpful is to actually walk through each of the questions, and we've got them on two different slides. So we thought you could do the first set and let Kathleen can kind of go over the second set of questions, and then we're asking folks to actually put other more specific issues, questions, concerns in the chat, and then if you're willing to speak to them, just raise your hand or unmute yourself or whatever and speak to the questions, because I think what's important to understand is that this committee is being tasked with helping districts and states. And so the more specific and articulate the districts and states can be with our questions, because I know that Kathleen and Jeff cannot speculate on the answers to these questions at this point, but I think that we really want to make sure that we've given the committee as good a guidance as we can about what our concerns are. So that's where it's a great opportunity to get that on the record and get that to them in a timely way.
Right, and one of the things that we've heard clearly in all these webinars and discussions is with the plethora of guidance, but what's lacking is clear, specific, sound guidance that is actionable relative to risks to students and staff, and detailed guidance on personal building hygiene and triggers and steps. And how do we do that? Because without the specificity needed to really actionalize this guidance, there's a great risk of misallocating very limited time and resources of capital, which have real consequences. So that's really what we're excited to work with Nathan on that. So yeah, please put your questions in the chat, raise your hand. And then Kathleen, I don't know if you're able to introduce yourself as well, and then we'll get into it.
Thank you. Yes, I'm Kathleen Moore, and I'm formerly with the California Department of Education and working at the local school district level. And also hello to my friends on the National Council, involved with the National Council through those activities. I really think what's unique here, I know there is a plethora of guidance, but is the intersection with the public health officials and the social and behavioral sciences. So I think it's a really good group that counterbalances the practicality of the need for school districts with the science. And I'm very interested to hear from the National Council members and others that are participating on this call about what are those issues that you believe, and we'll go through the questions, but that you believe need the science backing, or that you're struggling with, that this type of committee can provide better clarity about.
Yeah, no, that's great. So,
perfect.
So why don't Jeff, do you want to walk us through the first three questions and explain where these questions came from? Yeah.
Well, I'll try my best to do that. It's a very rapid environment. So there are 7 key questions that the committee is taking a look at. And, I think, well, let me just jump into them. Number 1, what indicators can state and district leaders use to determine if it is safe to reopen schools? Interestingly, my observation is that there is not a uniform set of indicators for this. And it seems as if states are taking the route of really letting locals decide. And I mean, my personal feeling is that school districts themselves are ill-equipped and not the expert to make those decisions because they're very detailed health assessments. The state of California, where I am at, certainly has indicators of moving from the phases of reopening, but those are broad phases of society reopening, so to speak, as opposed to specific to schools. So what are the best indicators that state and district leaders can use to determine it's safe to reopen schools, number 1. Number 2, when schools reopen, physically reopen, what are the practices for maintaining and monitoring the health of staff and students that will be effective and practical? What are the risks and trade-offs if some practices cannot be adopted or only can be partially adopted? And this really comes from seeing, very long and detailed kind of laundry lists of doing anything and everything to safeguard and check health trends. And the question is that this committee is really interested in and wants to help answer is, what's the feasibility of actually logistically doing X or Y or Z activity or intervention, as it relates to what we know or thus far about its ability for us to, is the cost of doing it, cost and time of doing something really giving us a good bang for the buck in terms of health and safety is really, I think, the element of that question. And then number 3 of the 7, how can safety decisions and practices avoid reinforcing existing inequities in education, instruction, and facilities? And can new safety practices help reduce these inequities? I think clearly an equity lens is very important for this group. Well, I'll leave it at that, but maybe do you want to go to the next slide, or did you want to, if you, Mary or David or Kathleen, if you want to say anything more about these 3, I would certainly welcome it.
Kathleen, why don't you go ahead and comment on these, and then let's move to the next slide, and then we'll work our way back.
I think we should move on to the next so we can get through it, and then I'm just really interested in the chat and into the questions that we may address in the work. I can go through these. I mean, the 4th, how should affordability be assessed in relation to mitigation of recommendations? There are, very many recommendations out there, and I think one of the things that I wanted or hope that the committee can do is, where is the best place, if in limited resources, to to place that investment? Is it, there's a range from cleaning high touch areas, or moving to sensor toilet fixtures. We know that districts can't do everything, and what is a ranking, I think, of the mitigation majors? What provision should be put into place for high-risk staff and students? Always comes up during the discussion. And is there, what does the science say about this, and how can we best form those recommendations? How will school mitigation be equitably adhered to? Quite a bit of discussion on this, I think. It's more the enforcement provisions, and we know those are always a little bit difficult. I don't know if we'll spend a lot of time here, but this was one of the concerns I think raised. And then how should the health and safety practices take into account the needs of students with disabilities? Again, I think a very important component is our special education population, both their transportation and education at the sites, and how do we address that? So those were our 7 key questions. I don't know, Jeff, if you had any additional input.
No, I don't think so. I mean, I feel like I want to hear people comment in the chat or raise issues. I mean, we've had, you know, about 9 hours of calls with this group, which, as Kathleen mentioned, is both social scientists, is medical researchers and professionals, as well as a number of other perspectives. And so the conversations have been very rich, but I think there's clearly an urgency. But, you know, I mean, we are operating in the reality of we know a lot about this virus, but we certainly have much more to learn. And I think that is a big challenge, as all of you are living.
So Jeff, let me, and Kathleen, how about I just get right into the chat and start popping up some of these topics that folks are bringing up. And as Mary suggested here in the beginning, if you know how to digitally raise your hand, then and you want to pose a question, please feel free to do that. So first questions really come down to this distancing. What is the specific guidance on distancing? As we've looked at it, we've come up with a different range of figures based upon different calculations on personal space, on top of the 6-foot social distancing, accounting for fixtures that take up space, so on and so forth. And the real pinch point that starts it all is the bus. And when we had that discussion in this group, with the consensus and listening to folks, is that folks are planning for about 10 people on a 77-passenger bus, and that alone is really driving considerations for how many kids can be on a campus at one time, above and beyond the capacity of the building and how you could use that. If we can't get the kids there reasonably, then that really is a major pinch point. So I think one of the big questions is there any variation in guidance for starting with bus capacity based upon how long kids are in the bus? Can PPE for a short amount of time increase the capacity? Why not? Is that different with different age groups of students? So on and so forth. That's one common theme that comes up there. As Julia said, schools are really good at congregating as many people as possible, and we're trying to do the exact opposite. I know you're not providing answers or speculations on that, but just some thoughts maybe on the capacity issues.
So let me just stop you there, because they shouldn't be speculating on it. But our folks who are in the field are absolutely speculating on it and trying to come up with various things. And so I would be interested in, we've got some big districts here. We have some smaller districts here. Sometimes it's the folks I know I could put on the spot. I mean, I can, Robin, I know that you guys transport a ton of kids in Montgomery County, and I'm curious just what on earth you're contemplating in terms of your bus service, and what you would like to know, right? Like, okay, if I could do this, if this was okay, then we might be okay. Or, is there any sort of specific thing that you've been wondering that we could throw at this committee?
That certainly is one of the biggest challenges, if not the biggest challenge. Montgomery County provides bus service for about 120,000 students, I believe. And so, even if we can get the facility calculations to house as many students as we can't get the kids there currently. So that's, that may drive the decisions on who ends up continuing to do remote learning. But it is definitely a challenge, and we are hearing 10 students or fewer per bus is what our transportation people are saying.
So I'm curious whether, I'm in the city and there are more than 10 people permitted on a city bus. Everybody has to wear a mask, and if the driver thinks it's getting too crowded, he doesn't have to pick up. But do you know Montgomery County also is in the same bus system? What's the, is there coordination between the public schools and their guidelines and the public bus system?
I can't speak to that. The Department of Transportation would be hopefully coordinating, but under the assumption that we talked about in earlier webinars, if we're assuming a student sitting every other seat,
Right.
in order to get your 6-foot distance in, that drives your capacity. Only increasing if you manage to get some siblings sitting next to each other.
Right.
So then how are you going to do that? Are you either going to run numerous routes, like back and forth and pick up, 25% of the kids each time, or are you
This is
transportation
still
to
in
a fewer
discussion
number of students?
But there are no decisions have been made yet.
Right.
They're looking at the different possibilities.
Yeah.
We've also heard that perhaps the schools and buses need to be the first line of screening, and if so, is that advisable? And if so, how? By whom?
Yeah.
I think the bus drivers shouldn't be put into that position of any liability for checking, whether or not there's some sort of volunteers before, at each bus stop or something like that. Again, this is all up for discussion. There's nothing in place at the moment.
Yeah. So clearly, I think Jeff and Kathleen wrestling with the transporting of children is going to be something that it would be enormously helpful for the committee to wrestle with, because if they don't, it's totally in the critical path, right?
Exactly, and I hear that here, and it's on the list.
Yeah. So let's move to another area.
Another
David,
topic came up on faucet fixtures, touching stuff, the cleaning of surfaces, and a lot of chatter on changing out faucets. So we need to change out all of our faucets to no touch. Is that a highest and best use? I think that sort of implies what's known about the threat level of this on surfaces versus airborne. That's been a discussion in this group, is where's the biggest threat? Us non-scientists are reading that it seems to be airborne, but does that translate into a proportional budget effort? Do we then proportionally focus more of our time and resources on HVAC renovations rather than surface cleaning and replacing fixtures? Because both are really expensive and funds are limited. That's another conundrum that we've heard in these conversations. Mary, if you want to elaborate, or somebody, Jennifer, I know that you commented on that as well in the chat, and if you wanted to ask the question directly.
Jennifer, can you unmute?
I had to unmute myself, sorry.
Yes.
Well, I was just, I think you're asking a good question about whether to prioritize air or the risk of touching surfaces. I was just giving the example because all I've heard is people talking about the sensor faucets and sensor toilets. And during N1H1, I thought the same thing when I was a superintendent. And so I changed all my faucets to those sensors, and the kids figured out right away how to change them. So when you opened the door, they turned on so that they ran all the time, and they were really difficult to manage. And so I switched them to one-touch meter faucets where you just touch it once and it sends out a metered amount of water and it turns itself off. And it was cheaper. Those are really expensive, inexpensive faucets, and they saved water and solved the same problem, because once you touch it once, you wash your hands, you don't touch it again, you leave with clean hands. So if you're thinking faucets, I would just say that. But as far as air versus touch, what I've heard is that there's no evidence of folks that have COVID that they're getting it from touching surfaces. The only medical evidence that I've heard is that people are getting it from human to human transmission, which would be, expressing the virus in droplets or in the air. So I think air and distance are the greatest preventers. Thank you for letting me talk. I'm done. I'll mute myself.
Yeah, some discussion and guidance really on the highest and best use, which I know is a question in there, is very much wanted. I think Amy Clark had a great question, just philosophic question. Should school requirements be based on what the public is being asked to do if it's about mitigating risk of spread? In other words, if the state is not requiring the public to social distance and wear masks in public, should schools? Are there any differences between stringent or less so that schools can consider than their state?
Hey, this is Amy. I'm having a tough time with this one, to be honest, because I definitely am not the expert. So I always remind myself that I don't know what the right answer is, but I do find it difficult to think of our students having to do the right thing and prevent the spread by eliminating our class sizes, spreading out on buses, social distancing, even taking temperatures, all of this stuff, but especially social distancing and especially mask wearing, because I just think that that's a significant ask for our schools, when it's not that significant of an ask to require that I wear a mask to go to the grocery store. And so it's, which we don't do in New Hampshire. And I'm not saying that we should do it. What I'm saying is that if we don't require wearing masks in the grocery store, how can we possibly ask our students to be the ones to prevent the spread rather than the general public? And it's just not sitting with me very well. So.
Yeah, no, I think that's a really interesting problem and dilemma.
And I don't know, Kathleen, Jeff, but kind of what would be related to that question is, what does the science say about transmission rates between folks of different ages? Is it quantitatively different for a 0 to 10 than the 11 to 15, than the 16 to 24? Are there differences that are meaningful enough to drive different strategy?
Well, to be truthful, this is Jeff again. This is actually a fair.
Jeff,
an epidemiologist from
you're coming in and out.
Johns Hopkins, as well as sorry. This is transmission between different age groups is a big unknown, to be honest, and it's an unknown in the science. And this is one of the key things that the committee is trying to wrap its head around. We have a researcher from Johns Hopkins, as well as a predominant doctor in Washington, who's, anyway, this is a big unknown.
Yeah. Letty Fogg, that's an interesting question. Has anyone done research on shields in lieu of masks for primary grade students? What's related to this question is, I think the common understanding is that ask a senior in high school to wear a mask and some of them will comply, most of them will be dazzled with some kind of markings of individuality or group allegiance. Ask a kindergartner to put on a mask and it's going to be off in about 7 seconds. Is there in the touching the face and just the impeding and somebody's, we've had great quotes from Philadelphia teachers and saying, how can I teach with a mask on? That Jerry was sharing with us. So are there research on efficacy of masks that we can see each other versus shields that we can see each other versus masks that really impede communication?
Letty, this is Kathleen. Are you talking about shields, wearable shields versus shields between students and teacher or student and desk? Is that what you're referring to?
The teachers I was
I'm
talking with.
Just jump back into it. Yeah, I'm going to jump back into it and
oh, that's Bob.
Sorry,
hey, Bob.
someone else is talking.
talking to you.
The teachers I was talking with were talking about having almost like that sideways headband with a shield on it so that the kids could put a shield on in class so that they could wear it rather than installing Carol type shields around every desk, which is just cost prohibitive and kind of not, it's so contra to all the educational theory we've been working through. So
No, I understand, and I understand the question. I actually think there's these issues of social distance, mask wearing, food service delivery, the temperature taking or that type of, the screening. I mean, each of these we have. Are there others that could be considered to be addressed through the science?
So people don't have any idea, Kathleen, what what the real science says. I think the primary consideration of the teachers I was working with was that they cannot teach English instruction to language learners who can't see their mouth. Mm-hmm. And so it is absolutely an instructional issue in a lot of our classrooms, and particularly at the primary grade where everyone's acquiring English. But we couldn't find anything that said one way or another. So I see some people are posting things, but they're from news agencies. We're looking for science.
So Letty, that's exactly the question that we will ask with those that are working in the science every day on this committee. And right. You're right, in some respects, there's some science. There's a number of European and Asian countries that have opened schools, and what is the science coming out of that? There's a Johns Hopkins report. There's varying degrees of that, and in some cases there isn't any. So that's what I think we're trying to do as a committee is any recommendation, where is the science on it? That can be the angle, or not the angle, but what this particular group can bring to bear.
Great, thank you.
Yeah. Guy Guy, Idaho has another great point there, is that we're talking about these risk mitigation activities that are absolutely necessary when we're in high, moderate risk environments. We know that we are talking to some school leaders in remote areas where this virus is not affecting them. What are some guidance for our rural communities where this is not a practical reality for them?
Maybe the question, Guy, on that is, if a case arises within a community that has not been, dealing with it, what do you do, right? If a case, occurs in school, there was just recently the schools reopened in Israel, and then there was a school where there was a super spreading event, lots of kids and teachers getting COVID. Then they shut that school down, but then they said, well, we've got to shut a bunch of schools down. And what's the right response? Is it just that classroom, just that school? So it might be that, you may not have seen this, but if you do, have a case in your school, then these are the things that you would do and how you would look at kind of managing that. Maybe, would that be helpful, Guy,
Mary, I think what we're running up against, and again, there are counties in Idaho that have not yet seen a positive COVID-19 case.
Right.
And we're asking schools to take, very, very strong risk abatement measures when there appears to be little appetite in the local community, that they're not that risk adverse at this point. They don't see the benefit. Now, again, as soon as you see a case, but is it if you see a case in your school, or if you see a case in the community, or you see it in the adjacent community that's 15 miles away, where they shop in your community? It's the questions are endless, and the issues become, why do we have to put all this effort in when there appears to be no need for it? I'm just telling you what we're seeing from a number of rural and more remote communities who believe that it's not necessarily an issue for them. And again, if we don't give them good guidance that's operational, that we can operationalize, and that we may not win this fight.
Mm-hmm. No, I think that's important. I think that it will be important to say, if you don't have, to at least ask the question, and I would hope that they would, basically indicate, well, if you have no virus in your community, there's no record of it, that you should be operating your schools fully. And that you shouldn't have to go to these, implement these mitigation measures. I think it's partly why last week was asking the question about, does everybody know the sort of its grade on COVID spread, so that the districts are responding appropriately to the level of risk, and not overdoing it because we think we need to be safe. All of the school people understand, once there's a shooting, oh my gosh, it's like everybody is completely under fire. And schools take very seriously that they have to keep kids safe. So it's hard, to kind of parse out, when it's appropriate to do which response. And I think the tendency is to probably overdo rather than underdo.
Yeah. Looking back through the chat here, and I think it circles back on some of the cost benefit questions we've been asking, and discussions. I'm just going to go through a couple of discussions about the bathroom, for example. And we talked about the no touch, and then Jennifer's challenge on that and seeing that implemented in some some unintended consequences. And then Julius Monk, maybe we can a foot pedal operated faucet as an option, and that certainly seems to address it. And part of I think the question is it advisable, given the risk of surface contamination, to redo our bathroom fixtures nationwide for this event, or is it more advisable to focus on, for example, the HVAC major renovations and work on cleaning and disinfecting protocols for those services? What would be some macro level guidance on capital versus operating solutions for surface and air, for example? And one of the questions that Jeff posed, and I'd like to pose it to the folks in the conversation now, the districts. Jeff asked, what about fresh air circulation in classrooms where there are inoperable windows or inoperable HVAC? How are people dealing with that? Can somebody chime in and say, I've been in many of these classrooms. I know they're there. That there's just the air doesn't move, the windows don't open. How are you dealing with that? Are you thinking you're not going to use those rooms, or are you mitigating it some other way? Anybody have some comments?
So this is Debbie White. I'm in a small rural school division in Virginia. So we heavily depend on HVAC systems, but they're individual units sitting on the roof. And so we've looked at, can we, can't really do a lot with individual units. We know we can't open the windows anymore. They're 60-year-old buildings, all three of our elementary schools. And we're really struggling to know what we can and can't do. We don't obviously want to not use a whole building. We don't have many choices.
So Debbie, you can't open the windows because they're not operable anymore, but they were operable.
They were operable. So. I put an appeal out to ask them to please go around and see how many of the windows, but I'm not the facility person, I'm the financial person. So I can't really force them to do that, but it is a question. We checked on the HVAC, what we could do on that in that regard. Obviously, if we had a whole school unit, it would be worth putting something in the in the system. So we're looking at, what is it, getting Merck 13 filters for each one. Hoping that all the AC units work okay. I know that some rooms, they have fans on year round to keep the air circulated. So again, we're really looking for some guidance, because that has a potential of getting to be an expensive expense.
Right, and also your utilities will increase tremendously, which maybe they should. Maybe we should be bringing a lot more fresh air in. There was a study recently that I was looking at on CO2 in classrooms, and it's well over what they should be breathing. Because they're not bringing in enough fresh air. But and I guess we know we would need to know what we're supposed to be monitoring in those rooms. So right now we're not doing any type of air control, air quality monitoring. So if we were to do something, do we bring in a CO2, some type of CO2 equipment? So, what do we do to monitor air that would be most effective for mitigating COVID-19 spread? Yeah, that's a good question. That's a good question.
And to Rob's point in the chat, not just in the building, but in the buses themselves. So should we be looking at, is that advisable, keeping windows open in the buses?
So we can open windows in buses. That's an easy thing.
Yeah.
Yeah, I mean, it might be if you open the windows, the kids have the mask and they're somewhat socially distanced. Maybe you don't have to go down to 10. Maybe you can go down to 30 or something. Make a huge difference.
Right. What would be a layout if that indeed lowers the risks? What would be a layout that would allow you to increase the capacity if that's indeed possible? Because that is like a first order problem in the sequence of looking at capacity. Another comment there that Robin, I just wanted to lift up, great thinking about the foot pedal operations for fixtures could be good for preventing germ spread from COVID-19 as well as other viruses and bacteria. And that's another potential area of guidance here is, any teacher and parent knows when school opens, it's time to go get the airborne from CVS and get the hand sanitizer because everybody's getting sick. And that's just an annual occurrence, for schools. And if we're going to make these high dollar investments in changing out fixtures and so on and so forth, looking at those as preventative measures for not just this particular acute issue, but, just preventing viral and bacterial spread in general.
So folks have got a few more minutes to add questions, and I just want, this is our, June 4th, which David and I kind of signed up for these weekly activities, which have been really so helpful, I think, in terms of trying to understand, what issues are out there and what concerns people have. And I think that both from these questions in chat and some of the other comments that we have from earlier programs, Kathleen and Jeff, there's a lot that we can submit. And I think one of the things that I know I had told the committee that I would do is, sort of more formally submit to them some of the specific issues and concerns that were raised, through these conversations. So we will do that and share that with you all. But one of the things to know is that I know the National Council, this is our last kind of joint webinar with Cooperative Strategies for now, partly because we need to step back and try to get our heads around, so much of what's been said and is out there, and begin to do some writing and reporting on what we have learned and what's being learned. So I want to certainly take this minute right at 4 o'clock to thank everyone for participating, and we will get the state directors together ourselves just to try to see what's going to make sense, from the position of state facilities officials. And so, look forward certainly to talking with our National Council members and partners.
And as Mary and I have talked about this webinar format and in moving forward here, the general timeline that we talked about is, for the next few months here, through about beginning to mid-August, we're going to pivot. So what I'm going to do is I'm going to resend out an invite to those of you who want to continue meeting. And what we're going to switch to is over the next 6 to 8 weeks is a interview format where there's many of us who've been together in these conversations week after week and have some stories to share, details about what you're practically doing in the weeds. And I think that's what we're ripe for right now is real detailed discussion and Q&A about some very basic things like the best fixtures and some unintended consequences. And, is it 10 or 14 on a bus and why? Those kinds of things. And what are you learning, from surveying your parents, interviewing them? And So what we're going to do is, from CS standpoint, is I'm going to send this out again and reach out to some of you who have volunteered that you would be interested in being interviewed in this format. And we're going to continue this conversation through August for those of you who want to meet, and we'll switch to a lighter, more interview format. And during that time, we'll be working with Mary and Jeff and others to put together the content that we've been working through and put that out into a report and website form. Really focus most of the energy on that and have more of it, but still keep the conversation going. And then in August, look, Mary and I are talking about probably coming back together and looking at a reopening at that point, as we're starting to get into the thick of reopening, to look at what's working, what's not, and just continue from there. Mary, did I say that pretty much accurately?
Yeah, no, that's great, because we definitely would like to, see what we can, kind of follow our own advice, to be informed, to be curious, be open, responsive, and assess. And so we want to kind of come back and see what, kind of what's happened, what have people actually implemented or put in place, what's worked well, what hasn't, what are the challenges.
Okay.
This is Rod. Good afternoon.
Perfect. Well,
I'm doing just fine.
I want to thank Kathleen and Jeff for being here on the call, fielding some questions. Thank you for hearing out the group on this, and very much appreciate the work that is to come.
Thank you for having us.
Absolutely. Yeah, no, really appreciate it. It's a big responsibility, and we appreciate you taking it on. Okay, well, thank you, everybody, and I think you've got our our emails. Don't hesitate to reach out. I know I promised some a study on the CO2 levels, which I have to find. I read these things, I put them somewhere, and then where the heck are they? So I will make sure that folks get access to some of the things that we've been referring to. You can find them on the National Council page too. We're going to keep adding things to that. So thank you all, and hope everyone stays healthy and safe, and really appreciate it's just amazing to me how seriously schools take public health, and I think it's indicated by the time and effort that everyone is putting into this. So thank you all, and
yes, thanks everybody, and we will send out again if you want to continue through summer and in discussion. Check your email here in the coming days. Have a wonderful, safe rest of your day, and look forward to talking with you again soon.
Great.
Thank you.